Konniwa. So I think now is 10 a.m. So we will start.
Yes, please.
Good morning from Bangkok. Very early good morning, good afternoon to all our distinguished participants. So I want to introduce again, my name is Zen. Today I will be MC for the whole section. So today is about module 5, day 3 demonstration, stigma, discrimination, participatory training. So Cont Niwat, P. Niwat will be a main facilitator and trainer for today. Before we start the session, I would like to request all the distinguished participants to participate in one of the activities that our colleague proposed. So it's about Zero Discrimination Day Simba. So I would like to request GT, can you show the PowerPoint for the butterfly? So I would like to request to all distinguished participants to open the camera, and also together we will do some demonstration to reflect the Zero Discrimination Day symbol. So 1st March, I think all the people may know the HIV Day, 1st December. Every year is a World AIDS Day. This is a Zero Discrimination Day, March 1st. So it's annual worldwide that even promote diversity, recognize that everyone count. So it's a butterfly symbol. So please open the camera, and so this is the butterfly symbol, and then the term will be like that. And this is, so please try with me, or I want to request to open your camera and try with me with this butterfly symbol. So this is how the Thailand use as a Zero Discrimination Day symbol. And also, we also want to know what is this? Do you have any symbol for Zero Discrimination Day participation? If you don't have, now you can consider. So I want to redress that March 1st. Every year, 1st March is a Zero Discrimination Day. So please try again with me. Okay, thank you for the participation. And so I think you will see the celebration of Zero Discrimination Day in Thailand. I think we could not celebrate this year because of the COVID. Hopefully we can celebrate next year. So after this welcoming activity, I would like to request Cont Niwat to explain today module and the activity and also the purpose. Cont Niwat, please. I give the floor to you.
Thank you, Dr. Sin. And good days again for all participants. Today is the 3rd day of the trainings. So today we're going to what modules? Do you remember what is the number of this module today? Mark from Timor-Leste, can you hear me? Can you test your microphone? Mark?
Hello.
Okay. Nina?
Yeah.
Okay. Do you know that today what is the number of this module?
Yeah.
Yes. Today is module 5, right?
Module 5.
Yes. So what is module 1
Module
talking
1.
about? So any colleagues, we away for a while. So can you remember, Dr. Albert from Tanzania? Since you said that you you answer the pre-test, you did finish the pre-test on the first day. Did you remember that what is the first day modules talking about? Can you help me?
Module 3 and 4.
Hello.
Yes, Dr. Albert, please.
Okay. Module 1 was on the ending of AIDS. Module 2 was concepts of stigma and discrimination. Module 3 was stigma and discrimination measurements, and Module 4 was concepts of 3x4 package.
Okay, good. Thank you. And what about Module 10?
I'm not sure.
Okay, thank you. But Module 1 is like a kind of, we look at the international conceptual framework, right? About stigma and discrimination. So we have guests from UNA's, I can't remember her name, but something like Bisley? Can you help me? Dr. Vino? Can you remember her name? The ladies from UNA's. No, but yeah, but it's we start with the bird eye views about international concepts on stigma and discriminations, and then the module 2 it's a little bit lower down to the country levels, right? In Thailand, and module 3 on last Friday, it's about measurement. I still remember that some of our colleagues quite surprised when you saw the way when you doing testing on the pre-test questionnaire, right? Can you remember that?
Yeah.
What is your surprise? Dina?
Yeah.
Are you trying to speak? Yes. Do you remember that about the measurement?
Once again.
Do you remember on the measurement modules, module 3, when you do online testing the recap pre-test surveys, and when you saw the answer of all participants, and there one thing that surprised us, it is about what? Anyone remember that?
It was about attitude. Some of us had negative attitudes towards HIV patients.
Yes, that's about that. Do you remember that? How many questions related to negative attitude towards PL-HIV? When you mentioned about we have like almost 90%, right? And we surprise ourselves that we're working on HIV for a long time, but still have negative attitude on that. So when Dr. Kliang Klai opened the questionnaire, there are 4 questionnaires. There are 4 questions, right, related to negative attitude. Are there anyone who remember that? What 1 or 2 or 3 or 4 questions? Can you remember? There one question about I will try. I'm not sure because I don't have the English version on mine. But some of the question is about, most of the PL-HIV, people who living with HIV, don't care whether they will transmit HIV to other peoples. And you have a choice like agree, strongly agree, disagree, strongly disagree. Like the others, something about people who living with HIV should be shamed about their HIV status. Anyone would like to talk about this a little bit? We have 5 minutes right now to recap. What do you think about this? I didn't see Dr. Vino. Since I just take a look at the person who opened their cameras and encourage you to share. What do you think about this?
It is interesting to know about the ways that Thailand achieved to reduce the stigma discrimination among the healthcare workers by 3x4 approach, and also monitoring system and continuous improvement of the quality improvement system and also the crisis management system. So several systems are there, which is not available in my country. So I would like to implement at least a few in after this training. Thank you so much.
Okay, good. Thank you. You finished my session right now. About the recap, you recap all of those things. Yeah, yes. Despite from the question or the question related to negative attitude towards people living with HIV on key populations that surprise us, there are a few other modes that we have learned from the past day, right? Like when Dr. Vino mentions about that. So today, we again, I will encourage you or request for you who feel comfortable to open your camera and try to actively participate. But it is okay if you feel uncomfortable because you would like to keep in private. It's okay for you to turn off your camera, but please actively participate. So today it's about demonstration. Yeah. After we for the 3x4 program, I'm still remember that there are some questions about sustainability, limitation of scaling up the 3x4, especially Niorn mentioned about dealing this kind of COVID pandemic in all over the world in Thailand. So it's hardly hit by the virus, and it's been very difficult to organize the in-person trainings. But anyway, today the curriculum is about, I will demonstrate and will encourage all of you to participate in the training session. I plan to do at least 3 activities. Yes, you need to turn off your microphone. Sorry. Okay. Today is my first online training. So I have lots of, I'm familiar with online meeting, but online training is my first time. So there might be some kind of difficulties or challenges or problem. Please be patient with me, okay? So today I have a team to help me to support for doing the training online. So Dr. Sin will be a co-facilitator, and the other support team from Division of AIDS and STI from Disease Control Department in MOPH Thailand. Since I was here at my home in Thailand, in Chiang Mai, it's up north in Thailand, so I'm not in the Bangkok room. So there might be some kind of delay on collaboration and coordination among us. Please be patient, right? So today I will walk you through 3 activities on the participatory learning and sharing. So since it's called participatory learning and sharing, so it means we have to learn from each other and share. So the ground rule, the basic rule is no right or wrong. Please kindly remember this. No right or wrong. It's about opinions and different opinions, different approach, right? So you have a right to share whether you agree or disagree among participants, among colleagues, even among me. Even though I'm a facilitator, but if you disagree with me, you have right to say no. You disagree with me. Yeah. But the way that we speak will be not blaming each other. Just say that, okay, you can say, this is fool, nonsense, something like that. But you say that you disagree with this kind of opinion, what kind of this, and what is your opinion? So kindly please share. Remember, no right or wrong, okay? And I will try to finish all those 3 activities on time. But if time rush in, like you are actively participate, I may have to jump in and cut off the conversation. Please apologize, right? Just warning you first. So today we will start with the first activity. But before the first activity, I will use my can Gigi share my PowerPoint presentation, please? If you do remember, the survey is one of the components in the 3x4 packages. The survey will lead us to understand the situations. In the early beginning, we do the survey to understand the situation of stigma and discrimination in health facility from the country approach. But when we start 3x4, we pilot and do it at the hospital basis. So it means we break down all the survey to all staff healthcare worker in one hospital before we start activities. So we implement the survey as a kind of baseline survey, so we know the situation. When we come up with the number of from the survey, it's just only the number, the statistics, but we don't know. Like when Dr. Albert surprised that it's 90% of healthcare workers in Thailand, they're dealing with HIV for almost 30 years, but 90% or 80%, it's quite high that they have negative attitude. So, but the numbers say that there are some situation. But the way to know, to understand in detail is we have to go there in the hospital and organize the workshop and allowing time for healthcare worker to tell us what happened when it's what does it mean when the survey show that you have high negative attitude, what this number means. So the facilitation workshop, the challenge and learning workshop is a kind of bringing in the participatory activities to go into the hospital and then ask them, allowing time to share and learn to each other, to understand, at least understand they themselves, what do they think about that, rather than understand the other. But the other opinions, their colleague in the hospital will be a kind of mirror to reflect back to them, they themselves, to understand they themselves, what do they think about HIV and key populations. So this is a kind of the way that we work together. So let me start with this. I will start with my presentation first, few slides, and then going to the activities. Next slide, please, Gigi. Okay. So I think I have no need to talk more about stigma and discrimination, since from the first day, friends from Tanzania, Cambodia, Pakistan, Sri Lanka, Myanmar, and Cambodia already mentioned about what is the meaning of stigma and discrimination. It's about negative attitude, behave toward people living with HIV. It's about difficulty to access to the healthcare services. This is the impact of stigma and discrimination. So I have no need to repeat it again, but this is just only a kind of picture that I bring in to remind you about the meaning of stigma. You see this, you isolate other people. Okay. Next slide, please. And what about stigma in relation to HIV, and why to do stigma reduction in healthcare settings? Anyone can help? Why we need to do stigma discrimination in healthcare settings? When I ask question about community participation in stigma and discrimination, many of you talking about doing stigma reduction in the communities. I mean, I understand that you mean in the village or in other settings. But why in Thailand starting doing stigma reduction in healthcare settings?
Can I?
Yes, please, Anessa, welcome.
G. Actually, the healthcare workers, basically you mentioned already, they are the role models. And our biggest issue is the compliance. And for us, it is important that the stigma should be reduced so that people approach the healthcare settings. Regarding your question about stigma in healthcare workers, it is very much important, because when we manage patients in the HIV clinic, it happens many a times that we need consultations from different departments. For instance, for some surgical procedures, for some biopsies or for some diagnostic procedures. In that case, when we refer such patients to some other department, they are already very scary and they are very reluctant to do procedures in such patients. Because of these reasons, the diagnosis get delayed, and obviously the patients, they usually present with complications. So it is important.
Yeah. Okay. Thank you. Let's cover all. Just to it will be very kindly if some people who speak fast can slow down your speed. It's been difficult for some, including me, to understand too, though. So please remember that to slow down your speed a little bit. So, but the question about why we need to do stigma reduction in healthcare setting, I think Anissa already covered all about that. Yes.
Hi, it's
Nina?
Ines from Timor-Leste. I'm actually joined with Mana Saturnina. I just want to also give a little bit comment in relation to the impact in the healthcare setting. I think in Timor-Leste, it's really important because based to our dropout cases, which is still high, that we really need to be also give attention to this issue and also try to also do some action on this. Like usually some organization doing this, like in Strata Plus and the other with working with Ministry of Health to try to provide the impact of the stigma that's make the people cannot access to the treatment, and also make the community also, I mean that the key population that's feel not comfortable. And here in Timor-Leste, what we face, it's the important to make sure the healthcare worker understood about the impact of the stigma and discrimination to the KP and also to the community. So we are really facing these challenges, and then we also get some important that working with Ministry of Health and try to also advocate for this. And thanks. Yeah.
Okay. Thank you. So it's healthcare setting is an important setting in necessity to access to the treatment, not just only for treatment but for prevention too, right? So it's important to be there to do stigma discrimination reduction in healthcare settings. But it doesn't mean that we will not do stigma and discrimination in other settings. But we start first here in Thailand, since like two of you mentioned already that this will be a kind of role model to roll out with this. And it's important to access to the services that necessity services for prevention and treatment on HIV. So can I go to the next slide, please? So I have no need to talk about this anymore. So I think you already bombarded by this kind of concept that it is important that stigma will help us to reach the goal, 3 zeros, and then the goal on treatment access 95, 95, 95. Thailand are on this pathway trying to go to these directions. And you may learn more in the at the hospital levels. So can we go to the next slide, please? So the question for me, give it to you, it's about what is stigma and discrimination in healthcare setting, reduction in healthcare settings. I do hope from the question to the last minutes will bring you some idea or some thought that you can apply in your respective countries. Can we go to the next slide, please? So this is the concept of implementing the training in the healthcare facilities. Like you can see, we have 4 key drivers right now laid out on the baseline. The first one is awareness. The second one is attitude. The third one is fear. The fourth one is policies or or environment in the hospitals. So the implementation, training, sharing, and learning, it's about, dealing or playing around with this 4 key driver to let the participant, the healthcare worker in the training session, understand why they have less awareness on stigma, why they have a negative attitude, what is the impact of fear of getting HIV in providing care will impact on the discrimination, and what is some of the policies, arrangements, or environmental or service system arrangement in the hospital that impact on the discrimination on HIV, related to HIV. So we will bring all the participants in the training to understand why. But to understand why, we have to understand what is the stigma form and where that it happened in the hospitals, right? And then from all of this, with the 3 World Wide Web, or the what, why, where, is we will finalize with the how to reduce it. We're trying at the finish of the workshop, we try to come up with the code of practice on the guideline, the written guideline written by the participants from the workshop about how to address the stigma, who will be involved, and when to start and finish the timeline, and other support may need to reduce. It may come up with for the whole system, service system of the hospitals, or may come up with just only some departments, some clinics. It depends on the sharing and learning in the trainings. So this is the concepts. So we do training to aim to make people in the training, the participant, the healthcare worker, to walk around 4 key drivers through various activities to understand what is the form, where it happens, and why they do that, what is the impact, and how to reduce it. So on the last day, we'll hope that we'll come up with that. This is the aim. Okay. So right now, I will ready to jump into the first activity. Can we have a next slide, please? This is the participatory learning and sharing. Next slide, please. Yeah. The first activity is we have to, bring all the training, all of you on board together, that we are stigmatized people and we need to change. Mostly when we jump into the hospital, it's a kind of defensive, mechanism that people will say that, no, I never discriminate or stigmatize other people. But this activity will bring you all in to understand that we are right now stigmatized people related to HIV or key population. But we'll not blame each other, just to kind of, wake you up and look around, look inside into your thought, your opinion, your attitude. So it's kind of, the objective is when we finish is we can identify the form that stigma and discrimination happen in the facility and explain why. Can we have a next slide, please? So the step, mostly the broadly step, Dr. Sin will tell you again, but mostly I will ask for volunteer, maybe 1 or 2, and pick up the picture, that I will show you. We use a picture as a tool to look around and talk and share. So I'll pick up 1 or 2 volunteers for each picture and let you talk about that, about 2 or 3 questions. And then we'll let other people talk and share about their opinions, and then move to the next slide. This is a simple step. Okay. The 3rd question is about what, okay. Yeah. The 3rd question is about what is happening in the picture. When you see from your eyes, just tell what you see. What did you see? No need to think carefully, no need analysis thinking, but just what happened in the picture when you see it. And then describe what is it. And then asking why they do that in the activities. And I will leave the third one with the in the last minute. Okay. I do hope that you remember that, but don't worry, because in each picture we'll have this kind of question to you too. Okay, next slide, please. So I would turn my time to Dr. Sims, my younger colleague who familiar with training tools online rather than me. So he can help me and you walk through the tools. Please, Dr. Sim.
So should I go? It's okay. Yeah. It's okay. I can screen. Oh, okay. So I will share my screen. So let me please give me a sharing screen. Okay, share screen and then okay. Yeah. So this is the activity that P. Niwat mentioned. The first activity. Okay, yeah. The first activity is the name of the activity is yes, we are stigmatizing and we must change. So we would like to first we will show the picture. Our facilitator P. Niwat have already mentioned. So there will be 3 main questions. What do you see? It's just about your opinion and say the reason. What do you think? Second question is why you give the reason. So what is happening? So and then and then we were also third question is about why do you think in that way, and then try to explain. Also, you know, P. Niwat will discuss and will raise the question. So I think we will start. P. Niwat will pick up if someone who would like to be a volunteer.
Yeah.
That would be great because actually our facilitator will not need to pick up. So please, when you answer, please open your camera and check the microphone. And so try to be proactive and more interactive with our facilitator. So we will start with the first picture.
Yes. Remember, no right or wrong, just opinions, no blaming each other.
Okay.
So don't worry.
Okay.
Who will be first? Sorry. First
Sure.
volunteer.
Okay.
So, hi.
Okay.
Okay.
Seems like friends from
we have a
Timor
volunteer. Good.
Just to clarify, do you need us to clarify the future?
Yes.
What?
Yes.
Yeah.
Yes.
Can I go ahead?
Yeah. Okay. Thank you.
Thank you.
I don't know Nina or
So
the
you
other
saw the
person.
future number 8, right?
This is for you. What did you see?
Me.
Yes.
All
what did you see in the
right.
picture? Okay.
It's look like in the waiting room.
Okay. Yeah.
And there are some people that look at the guy.
The guys. Yeah.
That sit close to, because he's got a lot of tattoo.
Yeah.
Something like that, and look like I think that they think like they have some negative thinking in their mind, and then look like they all look at that man. So that it's my that was in my mind. So I was say like,
what why do you think that they have negative attitude?
It's look like scaring people that sit close to us, something like that.
Okay.
Yeah.
Okay. Thank you. That's what you see. Did you right?
Yeah.
And in your opinion, why these people look scary?
Because of the tattoo in in that guy's body, and they wear the clothes that he was wearing. Yeah.
Okay.
Look like terrible, something like that.
Okay.
In my feeling, because
Thank you.
Yeah.
Okay. What other people opinions? Are there any other thing that you see differently from Timor-Leste?
But hey, can I just talk?
Okay.
For me, it's like I know that this is the guy is maybe come from the community or the other, but it's not. I mean that I think it's not good to be like if that happened to me or to other, I feel like I was like, ooh, where I am now, why they do like that? I feel like it make him feel not comfortable on that place.
Yeah. Okay. So the people who
it's like the discrimination also seems like stigma and discrimination.
Okay. So people who sitting there seems like their face show that they are afraid of that man, that tattoo man, and the tattoo man face seems like you look worried, you look sad, right?
Yes.
Okay. Thank you. So are there any
chance to speak in this picture?
Okay, Uncle Go, please.
Yeah.
What about you? You see differently?
Yeah, I would like to discuss about something in this picture.
Yes, please.
So, at firstly, in that condition, they judge the man in tattoos looking his appearance.
Yeah.
That is their first opinion.
Okay.
Just depending on just his appearance. Second.
Yeah. Okay. Seems like we lose Uncle Go again. The internet problem. Yep. The second opinion, please.
Without knowing nothing about him.
Yep.
They decide something of fear based on their awareness.
Okay.
On their environment or their education.
Okay.
Another thing is they are difficult to accept the different things.
Okay.
Your opinion, they are very difficult to accept different things, and such kind of reasons lead them to cause fear in their mind.
Okay.
And the fear causes stigma and discrimination in public areas.
Okay. So you're talking about negative attitude, about fears, right? Okay.
Yes.
Thank you. I saw hands up, raise hand from Anessa. Yes, please.
Yes. In this picture, I can see that the person with tattoo is segregated from rest of the people who are waiting, I guess, in a clinic, in a queue.
Yeah.
And the other thing about this is the person who is calling them one by one in some clinic, or is the one who is taking the appointments. Basically, he conveyed the message that be careful, these people are scary.
Yeah.
So the healthcare workers. So that's the most important thing.
Yes. Okay. Thank you. So the guys who talk about be careful, these people are scary, is a guy in uniform. So we guess that he is a healthcare staff, right? Okay. Thank you. That's the additional thing that Anissa see. So Pen from Cambodia. Sorry, I didn't see your names, but I see your family. You raise your hand, please.
Okay, thank you, Mr. Niwat.
Yes.
I think according to the picture show that the healthcare facilitator showed his negative attitude to the people who come to receive the service from him. Actually, this is the I think it seems like a stigmatized and discrimination to the people. Not only the scary man, a strange man who have the
tattoo.
Yes, but only the people. Actually, maybe they are the family one, right? Okay.
Yeah.
Opinion. Thank you.
Thank you. So we have 15 more pictures for you. This is the first one. But let me guess. Let you guess. A guy with the tattoo. Who is he? Is he a singer, pop star, singer, rocker, rock star? What do you think? In your opinion, a guy with a tattoo, is he a rock star or is he a?
Look like
What?
Look like rock star or art. The people from the art.
No,
art,
you're kidding me.
Because you know the hobby, the people sometimes they use like the tattoo. So, but for me, I feel like he doesn't care. He feel like I doesn't care even you look like me, and he try to look to other, something like that.
Okay, but normally when we saw this guy in Thailand, what do they think? They think about people who use drug. When they saw lots of tattoo, they didn't think that this is a rock star. But surprisingly, last training workshop 2 years ago, there are some medical doctors from Israel, from other countries who also do tattoo too. But tattoo is related to, in people in the old generation like me, think about bad things. But right now, tattoo is becoming new generation. Definition is about fashion, beautifuls, right? But in some generation, they still think that tattoo is some kind of related to bad guys, especially normally, or maybe they guess that this is a drug usage. So that's why they're scary. They're afraid of that. Okay, thank you for your participations. Let's move to the next pictures. But before that, I need the volunteers again who will go with the second picture first. Raise your hand. Oh, okay. It seems like we go to the picture first. So this is the picture. So okay, I need volunteer first to start to kick the ball.
Okay.
Okay, Umanat.
Yes.
Thank you.
From the picture, I see a man who will open the HIV and TB screening room, and two nurses look at him. And the screening room have a window, can see inside the room.
Okay.
And this guy, he look like unhappy.
Thank you. Look unhappy. Yeah. What did you see? More? Any other things? Okay, thank you, Umana. You see the guy. You mainly focus on the guys and the clinic room. Yeah. And Anissa, you raise your hand, please.
Yes, the nurses are talking suspiciously about him, that this person is entering the screening room. And this person already seems upset and anxious because of entering and getting his test done. And he is more anxious because of the suspicious talking of the healthcare worker staff. And that is inappropriate.
Okay. Thank you. Thank you. Dr. Albert, if you are those two nurses that Anissa mentioned about their two nurses talking about this guy, but if you become that one of the nurses, what will you talk about him? Let's pretend.
Okay, thank you for this this opportunity. I think I concur with my colleagues that it seems like the two nurses were talking possibly negatively, or they were wondering like, why are you entering there? Or maybe this person might be having HIV or TB. So I think that basing on the nature of that room and being the healthcare workers, they are not supposed to stand in that way and start talking to with each other toward the guy who was entering in the screening room.
Okay, thank you. Any other thoughts from Lao colleagues? Yes, please say.
For this picture, discrimination is like one guy that he has a look from two nurses. They look at him like something will happen with him, and he feel like uncomfortable. Even two nurses, they don't know he stated that he HIV infected.
Yeah. Okay.
It's like a kind of the discrimination.
Okay. Well, the way the nurse behave, right? Like you can see that it seems like negative behaviors. Like they look down, and the guys who entering opening the door is like look sad, upset. But the key message is on that HIV and TB screening room. That Dr. Albert mentioned it. Why this guy opening this door? He HIV positive or not? Something like this, maybe a kind of gossip, something like that. Okay. Thank you. Well, I do hope that we still have time for the last picture. Can we go to the last picture? Another picture, the last one, please. Let's see. Okay. What about this picture? Anyone volunteers? I will request for a guy who's okay. Suchira, she raised her hand. Okay, thank you.
Okay.
From Thailand.
Okay. From the picture, I see two groups of people.
Yes.
A nurse and patient. Is a nurse talk with patient that you are HIV positive, why you don't get sterilized? Don't you feel sorry for the kid? I think because a nurse fear that HIV will be transmitted to a child.
Yeah. So you think that the nurse saying that because she feel worried that the newborn baby will get HIV from her mother.
But the patient seem like disappointed and sad.
Okay.
Okay.
Anything else?
Okay, it's over.
Okay, thank you. Any other additional things from other?
Yes, from Timor.
Okay, from Timor Leste, please, and then followed by Albert.
It's clearly writing there that you have HIV positive. Why don't you get sterilized? It's like the force this lady to do this sterilization.
The force, right?
Yes, and this lady looked like surprised, something like also scared, because I think maybe she on the treatment looked like she was really confused with this force from the nurse. So it's for me it's really serious. This is need to be really give I mean that if the some warrants to this nurse. It should be like not like that.
Not doing that, right? Okay,
Yeah,
thank you.
of course.
Thank you.
Yeah.
Okay.
Thank you.
Well, Dr. Albert from Tanzania first, and then followed by Goson from Cambodia. Yes.
Thank you. I had this almost the same opinion with my with the previous participant. It seems like this nice healthcare worker is directly stigmatizing and discriminating the patient. Like she's denying or like she's blocking her from getting her rights. And looking at the facial expression of the patients, it seemed like she was like wondering, do I not have a right to have a kid? While we know there is the program or the interventions of preventing mother-to-child transmission. So this healthcare worker is directly discriminating the patient. Thank you very much.
Okay, thank you. Dr. Albert mentioned about we already have the program to reduce HIV transmission to the newborn baby. It's called Prevention of Mother-to-Child Transmission, right? But if you do remember in the chat box, I think last Friday, there's I can't remember, but I from my remembrance, it's about a colleague from Thailand said that is it possible to provide better knowledge, and then the discrimination will, gone. But even though nurses in the hospitals know that there are a program that can reduce transmission rate from to the newborn baby. So it's but she's still forced, right? A friend from Timor-Leste said forced about that. So it's not it's mean that even though we have better knowledge, but it may not, the discrimination still over there in the hospitals. So let's finish with Goson. Oh, I saw another hand from Anessa. So Anessa will be the last, but Goson first, please.
In this picture, what I can see is that the patient is admitted in the hospital. That for sure means that she is not in a well condition. So the information which the nurse is giving is part of counseling, which usually are being done in counseling sessions. And the thing is performed by the clinicians, the doctors, and they do it with informed consent. And the content of the counseling is also very negative, and we should not do it this way. And usually we do not do this way.
Okay, thank you. I see some kind of additional view, additional point too. Okay, Goson.
Thank you, sir. For me, my opinion is according to the picture, the patient who come to receive the service look like scary with the word that healthcare providers say to her. Like it seems like to blame her, like don't understand about what she come to receive the service. And actually, the healthcare worker, it seems like low counselor skill to the patient, or don't understand, don't understand what, like Mr. Albert mentioned already, the how to prevent the HIV transmission from the mother to child as well. Okay, thank you.
Thank you. So some of you, like Goson and Anessa, mentioned about something that we call code of practice, to do it better. Like you said that you do consent, better doing good counseling for the ladies. But Suchila, for her first thought, she said that this nurse might be worried about the transmission, right? But friends from Timor-Leste say that this is a forced action, right? So this nurse maybe have a good intention to help because she is worried. If it is good intention for helping, will we consider this is a stigmatizing? Is this a discrimination? So people may, if we have more time, we might go deep into detail about that. But just to share, just to summarize, this thing is about, we talking about different point of view, So this nurse might, I don't know what really exactly what is her thought, but the way that she did, we consider that this is a discrimination, but it might come with a good intention, but lack of good skill or good counseling. So this might happen around in the hospital. We don't know. Okay, so we don't have time to go to other more pictures, but I will finish this with, can we go back to the slide presentation, please? Yes. There's a message in the chat box said, nice to see active participation in this game. Wow, it's these activities with the games. Okay, can we go back to the slide presentation, please? For this activity, the first one is, yes, we stigmatizing people and we must change. I have, 15 pictures, but I will give it to you later after the trainings. But this is a kind of we just go through only 3 pictures. So from this, what did you learn? I'll ask the question. Go back to you. What did you learn from this first activities? Can anyone respond? Yes, Dr. Albert, what did you learn?
Thank you very much. From this activity, I learned that S&D is really there in the health facilities, as we saw, and this is probably brought with some of the drivers that we were taught about, issues like negative attitudes and probably lack of awareness. For example, with that picture of the nurse who were forcing the lady to be sterilized, that was probably, despite that she might be having a good intention, but probably the lack of awareness on the issues of preventing of mother to child HIV transmission, that was a driver for her to say that statement. So in summary, this stigma discrimination is real there in his facilities, and it is brought with some of the key drivers. Thank you.
Okay, thank you. 2 points, 2 key points that you mentioned. Yeah, and any other thing from other colleagues that what did you learn from these activities?
I think we learned that stigma is there in the hospital, and there are different forms of the hospital, and we highlighted the role of different healthcare workers in creating this stigma.
Okay, thank you. Any other things?
I think what we what we have learned here, the stigma and discrimination, not just came from the community, but mostly what we should give a point here is came from a health facility and healthcare workers. Like in the image number 2, we already judge, we already give like reduce the self-confidence for patient to come, for accessibility to come to testing, and that is the most, some case like this can give a result like we can lost patient do not want to come for testing. Some like we also can count this like lost case also. Then, and it's also not good for improving the tracing for a patient, because we already stigma and discriminate. We make them lost confidence, lost their self-confidence. Like we don't give good things. I think it's not just for community, but mostly for also health care workers. We should learn also. Thank you.
Okay, thank you. That is Dr. Mark from Timor-Leste. Okay. The last one. Who will be the last one to add more? What did you learn from these activities? Anyone?
Yes, we can use these similar activities to train our healthcare workers in local setting to reduce the S&D.
Okay, thank you. So I think may I say that you impressed that these tools, the picture, simple picture can, bring in the learning and sharing. Yeah. Okay. Thank you. So, can Dr. Sin summarize what did our colleagues participants mention in their these activities, the learning from these activities?
Catch up some of the point. If I interpret wrongly, please forgive me.
It's okay.
Yeah, so I think this is not a sequential, but it because of the picture arrangement, so it go down first. So our distinguished participant with timor-leste mentioned that all the waiting patient are looking at the tattoo man, and also they look worry. The tattoo man look worry and sad. Sorry if I labeling kind of tattoo man, but I make it more imaginary and more conceivable. And so also the participant from Myanmar also mentioned 3 main points. Judged by his appearance, also without knowing the background, because they these other patient labor from their previous experience. So the people who are tattooed might be bad. Some kind of attitude is influenced by their environment. That's how they. So our colleague from Pakistan also, that some of the healthcare workers don't have a right attitude to the patient, and they seem to be discriminatory from even, although sometimes they also have some training and some awareness. Sometimes some of the healthcare workers unconsciously create that kind of attitude. So our colleagues from Cambodia also, the healthcare worker create negative attitude not only to the man with tattoo, also the people, the other waiting people, because he ignore the existence of other patient in the waiting room. That is how they try to mention. And Niwat also give some opinion and also some discussion. So that is a general summary of the first picture. So Niwat, do you want to add more, or maybe as our participant want to mention something that I missed?
No, thank you. But this is okay. I can see what you and the teams are summarized, written down in these pages. So can you highlight just only some point? Since
okay, yeah, I think I will be I will be cautious about the I will be aware of the time. So for the second picture, actually most of participants provide the same opinion. Yeah. Especially the 2 nurse, the healthcare provider, they judge without knowing the result, and the man looked very anxious and sad, although he doesn't know whether he will have HIV or not. So that is, it might create kind of, let's say if he one of our colleagues mentioned that if he have a positive, he might not come back again. So that is not good for contact tracing. That is a very good point, because if he feel insecure, he will not come and see the doctor and nurse for his continuous treatment. So we should be aware of that. That is a good point. So for the third picture, actually, the main point is the nurse is not aware of the or maybe denying the existence of the program of mother to child transmission, or maybe she doesn't know, or maybe she doesn't know the counseling part. That's what they raised. Most of our participants raised that, because probably she is doing in her good faith, but maybe she might behave not properly. And then it very, so the one word that I like, directory, one of our participant directory, and we should be more, how to say, should be more using soft tone. Maybe, yeah, there will be a language for that. So that is what I noticed from the discussion. So this is the summary, Piniwa, and do you, if you want to add more, or yeah, so please.
Okay, what about the go to the next pages that they learn, all the participants learn from these activities? I think we agree, we do agree, right, that this activity, this first activity is kind of a good warming up, right? It's a good warming up of the activities that walk you through the agreement that the stigma there in the healthcare facilities. And some of the picture even show you that if you're doing discrimination or stigma like this, it will cause an impact to the client. They may not come to the hospitals, and we cannot help them, and we cannot stop to the transmission of HIV in our own countries, right? And from Tanzania also mentioned that it's good warming up that walk you through drivers, right? You said about negative attitude, we learn from the pictures, right? It's about less awareness because you gossip on other people. It's also about environmental. If you remember the second pictures, right? When you set up your clinic and you labeling the name of the clinic of that, HIV and TB screening rooms. So when I go there, if I would like to go to this clinic, it might be difficult for me if I will afraid that people will remember me, do some kind of bad things. So I have to go to test. So this is the way that you arrange this kind of, this is a kind of arrangement of the services that's showing that this is the maybe stigmatized people who use the services. So something like that. So this is all that you learn, right, about that. And it's important that to reduce stigma and discrimination in hospitals. So stigma might come like verbals, refusing treatment, wait for a long time, breaking confidentiality, or even the other thing, do something without consent, like Anessa mentions. Go to the next slide, please. And the way that we isolate people, look down, think negative is about, we said that it's the stigma. But the way that we act in the result of the stigma is called discrimination. I think you already know that. Just repeat it again only. The next slide, please. So here, there are what we call is social stigma is isolate people, shame and blame people, and discriminate people. It's unfair treatment. But the other, this I would like to mention here is the next slide, please. Rather than the social stigma, it's called other form of stigma. It's called self-stigma or internalized stigma that we discussed in the first day, right? It's the impact are the consequence from the social stigma. So that people internalize, accept the negative attitude into themselves, and then they look down on their own self. So it's called self-stigma. And also we have other kind of stigma, like a kind of, layer of stigma. If you become, if you are, people might already look down to you. If you are sex workers, you are people who use drugs. When you have HIV positive, it's kind of double stigma, a layer stigma on that too. And the stigma also are kind of related to associate people in your family and others who are related to you. Next slide, please. So this is in conclusion, right? Walk you through the at least some kind of drivers. Next, please. Yes. So we finish with the first activity behind the schedule, already behind the schedule. So please allow me to go grab your hand, please. Thank you for active participations. Thank you. And please allow me to jump into the second activities. Okay, second activity, the blame games. Maybe some of you are already have an experience or participate in this blame game. The blame game is intent, the objective of this is intent to walk you through the game, and then finally you identify the level that used to stigma people living with HIV and AIDS and key populations. Next, please. Okay. The step is we will providing you an online tools and write all the words that you call people in this said groups into the onto the tools. That's very simple, only like that. Simple to explanation, but maybe a little bit difficulty to participate. So I think next slide, please. Okay, go back to Dr. Sin. My co-facilitators will help you walk you through the online tools. Dr. Sin, please.
Thank you, Niwat. So yeah, so maybe probably I talk a lot in the first activity, so it become behind the time. So I will share the screen. Okay. So the second activity is the name of activity is a blame game. I think our colleague have already sent remind the email about to prepare 2 device, because we need 2 device, especially who use the phone. So we need to access the Kahoot.it. So it is mentioned here. So so please open the other device, and also please enter the website, or maybe if you are using your phone, using your on the top you drop down, there's a called QR scan, and then you can scan to the QR, and then it will go directly to the website. So please, if you need help, you can type in the checkbox. Also, you can unmute and ask the question. So our team is here to assist. So please go to the website. It's highlighted in the red color, or maybe you can scan with QR. The same application that we use on the second day of the training, I think. And also it now, I think our friend have already mentioned in the checkbox, so you can click on. Okay, the second step. So I think everyone in the website. So you will see the picture on the call and log in the game. You will see the picture beside that. So the game pin is one. So there's a pin that we have to type in. So it's 191. No. Oh, okay. Oh, okay. Sorry. So this is the pin. Sorry, this is the pin. 196236. Please enter. Is it the right one, right? Sorry. So this is the pin that you have to enter. Please, okay, now it's entering now 4 people already. Okay, Dr. Albert, so 5 people, 6. Okay, we have more. Thank you. I think so the pin is 196236.
Seems like Dr. Swin, seems like Uncle Go, Lieutenant Uncle Go need the QR code again.
Oh, okay. QR. So maybe the previous slide. Oh, so I think G, you can I can share. It's okay.
Yeah, Uncle Go, Lieutenant Uncle Go. Go ahead.
Yeah, you can scan, and then if I speak slightly fast, please ask me to slow down. It's okay. Sometimes if I feel excited, my talking becomes faster. So apology for that.
That's okay.
So how many people already? 1, 2, 3, 4, 5, 6, 7, 8, 9. Oh, okay, more. 2, 6, 12, and now 16. Or maybe I also have to enter. Okay.
For those, we have like 38 participants, including our teams, but only 16 on board for the Kahoot. For those who cannot enter to the Kahoot, the next we will try. Yeah, like you can use your chat box.
Yeah.
If you cannot enter to the Kahoot board, so you can use your chat box. Okay.
So I think now how many people? So should we, Niwat, should we start?
Yes, please. I guess that I'm preparing 5 or 6 group of activities on this activity, but I think we have only 1 groups available on times only. I mean, we can do it's only 1 times. Sorry. Okay. So can we go to the game?
So
the blend game.
So we will start. Okay.
Yes.
Please. 3, 2, 1.
Okay.
Okay. So people in your country, name, how do you call the people living with HIV as? So you can type. You can type the answer. So if you can't type, you can also type in the chat box. We will copy. We will take it. So you can type in your own language too.
Yeah.
You can type in your own language.
Try to type as much as
you can. So we will capture. We will capture.
Yeah. But with the limitation of these tools, you can type only 1 time.
Yeah. So
if
it's
you
only
have different.
Sorry.
Yes. Dr. Sin?
Yeah, please, Niwat, I think there's only 7. Okay, more and more, please, because if we speak, 2 of us speak same time, it will make maybe a participant confused. So I will be now quiet.
Sorry, thank you, but thank you very much, Dr. Sins. So this is a game that you say that people in your country, name or call people who living with HIV and AIDS. That what you heard, or the way that you call people, or you heard from other people in your country call it. But when you type it, you can please type as much as you can, but you can type it only 1 time. So if you have different name or call, type it in 1 time only. When you go enter, you cannot type it anymore. But if you have some more, you can type it in the chat box, please. So right now they have 11 answers. I will ask the friends from Bangkok control room, please help me to look at the chat box too, right? Please. Okay, we still have some few more minutes, 2 minutes to write it down as much as you know.
Okay, okay, Kap.
If I'm not sure if there are some friends from control room in Bangkok, if you're not registered in the Kahoot, then can you just register and then type the other words in the chat box into this board, the Kahoot board, if it's possible, please. There's some. Okay, less than 1 minute. There are some more. Aha, there are some friends, colleagues from Lithuania. Okay, it's finished. Let's see. Okay, this is what we saw. Yeah. So there are some that I written down in your own languages. So let's walk through this. The first one, the biggest words, it means that many people typing down on that, right? So the biggest one will be AIDS patient, right? And followed by also some AIDS patient too, with different typings. But the other thing is about, I think Pasat Thai is Cont pen AIDS or AIDS patients, right? And people ART, antiretroviral treatment patients. The other thing, HIV infected people, AIDS, HIV infected patient, AIDS, HIV patient, PL-HIV and KP HIV patients, AIDS malice and mulak for HIV. So there's some words that I'm not understand. Can the person who write maluk for HIV explain more what does it mean? Please.
Okay. Actually, it's from our language in Timor-Leste, Tetun. Maluk. Yes. Maluk is mean like a friend or like a partner or like a family. It's like that. It's like a word we use. Like it's one word, but it's have a lot of meaning. It's like a friend. You can say friend, family, or partner or whatever. That's we call maluk. That's to prevent. We try to make like HIV is not like a different person. So we use the word maluk. Maluk is mean like friend, family, or like to use to how to not differentiate them with us.
Okay. Thank you. And what about AIDS marriage? Who's typed that? The red one in the baseline, on the baseline. Patient in Pakistan. Okay. Okay. So anything else from the chat box? Can anyone monitor the chat box and then help me, please?
Maris in Pakistan is patient. And
yes.
We use very slang words for such patients, not in healthcare setting, but otherwise we call them jahaz, which is drug addict, which is aeroplane in English.
Okay, thank you.
There's another slang word, nashai.
Okay. Okay. Are there any additional words in the chat box, friends from Bangkok?
Yes. Yes, I think that Anissa mentioned jihad already, and okay, I think nas or drug addict. Okay, it's a nahasi. So okay, I think no additional word. I don't see. Marit or is it a Pakistani word? I think that's all. I've already mentioned in here too.
Okay. Okay.
Yeah.
Seems like we need one more times. We need one more time. Can the people in the control room start the game again? But can we start with the people who in your country call or name people who you struck? Oops. Okay.
No.
That's fine. That's fine.
Okay. Okay. Yeah, please.
Can you answer this question? Can we do it again? This is the second group. People in your country name or call men who have sex with men as what? Okay, it's time. Okay. So let's see. The name that happens in the Kahoot platform is Choka. Many people have mentioned about gay, Maluko HIV. So I understand Maluko HIV, right? Diversity man, BL, HIV patients, and some in Lao language I can't understand. And in Thai is Sai Leung or yellow line. Yep. Okay. And homosexual gay. So can we go to Choka? Choka, what does it mean?
Yes, shoga in Swahili language means the two individuals belonging to the same sex who keep secret for each other. So in our communities, shoga means the men who sex with men. So it's like gay.
Okay, thank you. And what about Lao colleagues? What does it mean in the green line? I can't read it.
For the green line, it's the same as the Sai Mi Phet Sawan Kao Sai.
Oh, okay.
Yeah, it's like a soposo.
Soposo. Okay, thank you. What about BL? BL, what does it mean? What does it mean, BL? Person who write it down, please.
Yeah.
No response. That's okay. That's okay. Okay. From these activities, I really wonder. We go to two groups, right? The first group is people living with HIV and AIDS. The second one is men who have sex with men. We still have 4 more groups like transgender women, people who use drug, sex workers, and we can add more others like migrant workers, something like that. But the intent of doing this activity is, to ask you to write down the name or the words that you use to call this group of people in your country. Please kindly inform me again that this is the word that you use in your own language, in your daily life to call these people. Are there any other things? No more game anymore. We don't have time, sorry. Can we go to the slide, please?
Yeah, slide.
Yes, we don't have time, sorry. The situation changed. So I think that when you this kind of game, you know, I did it. I can say that we cannot from your response, we cannot go through that, you know, because mostly the word that you use is a kind word, you know, a word that you use in general, but not a word that people use in general. I'm not sure whether you understand me or not. For example, there are some words that the Thai colleagues use, you know, typing, if you remember on the Kahoot platform, the words that they use to call men who have sex with men is yellow line. So yellow lines mean it's represent, or it's the meaning is about when you have sex with through the anal sex. The yellow is mean the color of shit, right? So you use this yellow line to call other people, especially the men who have sex with men, or sometimes transgender women, to say that they have sex through the anal sex. Some say call the people who living with HIV/AIDS in Thailand called dam long. You know, it's the words in the very early beginning. Dam, it's mean black. Dam long, it's mean deep down, dark or darkness, something like that. It's the way that they call people who living with HIV/AIDS.
Okay.
On appearance on their the way that it happened when they diagnosed with HIV. No. We don't have time to go. Can next online even turn off microphone? Okay, thank you. So I would say that actually we'll go through the words that you say the give, right? And then you see that what kind of this word look like. So mostly you will see the words now. If you are, I think you are too polite to say directly. It happened when we do this kind of this activity with a person in the division of AIDS or in the disease control staff in the first time. People will say like just only in general, patients, people living with HIV, MS, and something like that. But it's not the word, the name that you use in your daily life, in your social life. You know, the word that you hear people in your country call this group of people. See, you understand this? What I try to say? And it's a smile again. I would like to say that I'm failed in you know, walk you through this game, you know. So mostly because you are too polite, you know, you are not represent what you are not represent what people in your country call or think about this group of people. Like mostly, I think we have the same words when you call people who use drugs. In general, in your country, people in general, what do they call people who use drugs? Okay, Anessa, please.
They call them usually Nashai and Jahaz and other slang words. I just want to add one thing here.
Yep.
I was working in the National HIV Center. That was the country head. So the consultant in charge of the unit, our professor asked him once that why don't you get the telephones of mobile phone numbers of all these patients registered with you so that you can call them anytime. And the remark the treating consultant passed for such patient was so embarrassing, even for me also. He said that, sir, these people under drains and there are no mobile phone signals going over there. So there's no use of registering their mobile phone numbers. So this is the stigma which they people face.
Okay, thank you. In Myanmar, do you call people who use drugs
as junkie? Sin too? I saw you knock your head. So you agree with me? In Myanmar, do you call people who use drug as junkie? Garbage.
Drug user.
Drug users. And then
Yes.
any other word? Do you คนติดยา
Just abusers and users.
Okay. Seems like, well, I have to confess, like this is you are too polite to, yes, Kia, you're too polite to write down. Mostly the experience that we do is like, okay, garbage is sujila, I mean, in that. So when we do this blame game, when you think about this group of people who are people living with HIV and AIDS and key population, what you heard people in general call them, they will use like, bad languages to call them, right? I think you have experience to heard about this name, So the bad languages that they call, it's hurt people who was calling by those names. When you said they are garbages, they are junkie, it means you valueless their human being. No. So this is not you, exactly not you, but this is the people in general in your country, in your society. And you don't know why they call these people like that. You don't know what is the person who used this word first. But when you born, you already heard about this kind of words flowing around in your societies. So this game is just a kind of walk you through this, bad attitude, a negative attitude towards people living with HIV and key population by the way that you heard other people in your country call this group of people. And you are one of the group in your societies. Sometimes you may use the word again. But the important thing is about, it's not using the words, but it's about the negative attitude toward this group of people. You have negative attitude. We in our society have negative attitude towards sex workers, towards people who use drug, towards people who living with HIV and AIDS. They are promiscuity. They are sin people, bad guys, sin. So when you consider people with negative attitude, sometimes automatically you will react to them in the negative way. You will look down to them. You will discriminate them without intention. So this game is, walk you through that. This is the purpose of this game. But it seems like I mentioned, that you're coming back, the way that you respond is very polite. You didn't use, I'm sorry for force you, but I think that you didn't use the general words that in the people in your society use. Sometimes it's happened when we do this in the hospitals, because people protect themselves, and they, even though they have good attitude towards this group of people, so they use like the word that you use, men who have sex with men, people who living with HIV, AIDS patients, something like that. So this is the second game. So we success in the first game, but we fail in the second game. I'm sorry, I cannot walk you through the objective of this activity. Are there any questions for the second activity, the blame game? No. If you don't have anything, like I confess to you that I'm okay.
Hello?
Uncle, yes, please.
Yes, I would like to make you a question toward you. Have you ever give a smile to a drug user when you encounter him or her?
Sorry, I lost you, Uncle. You said that when I met drug user who are male or female, have I what? Can you repeat your question again?
When you meet a female or male drug user,
yes.
Have you ever gave a warm smile at him or her?
A smile?
Yes.
Okay. Yes, of course. A smile.
Yes.
I give. Yep. But sometimes,
Thank you.
When I work with my grant workers too. But sometimes
there is something I want to tell you about the discrimination. When you gave smile at the drug users or other kinds of patients, when we gave them smile, wall between us, So
You're correct.
if we want to build
trust
without discrimination, we have to give smile at them.
Okay, thank you. That is the way that we behave, right? They can understand from the way that we behave, we speak. Yeah. If we would like to create a good relationship, respect to them, we have to think about that way. Thank you, Angoko. So let me stop for 10 minutes for go to the restroom and then come back, if it is okay. Can we? Okay. 10 minutes only, and then come back to the training room again, online again, please. Thank you.
Anyone, can we start the next session?
So should we start, Niwat?
Yes, please.
So
the third activities.
Yeah, third activity will be.
Can I have my slide, please? Again, before we go into the third activity, right now we have 1 hour. I will try to finish this in 30 minutes. So we can have the 30 minutes for the next sessions and then the question and answers. So again, apologies for me for cannot success and walk you through the second activities. Please accept my apologies, and we'll talk about this later on. So the third activities, it's about one of the driver that many of you mentioned in the discussion on the previous day on stigma and discrimination in hospital, in health facility. It's about fear. So many of you are talking about the stigma and discrimination happens in health facility because of healthcare workers are afraid of exposure or acquiring HIV while they're taking care of the patients. So this activity will help you, will bring you in to the discussion, learn and share together about this. So we do hope this is just only a demonstration, but actually for the finish of these activities, the third activity will help the healthcare worker who participate in the learning and sharing to describe and analyze how fear and concerns of exposure to HIV when you're taking care of people lead to the stigma and discrimination, and how to reduce it. Okay, so next slide, please. So this activity will use the tools of, you use the pictures again, but the picture will help, will ask you to answer to the question, to the picture that I will choose the pictures, and then I'll ask you whether when you see the picture, when you take, do you think that the action in the picture are risks or no risks or not sure of exposure to HIV? And then I will ask you the people who answer, describe or explain what do they thought, and then ask if everyone agree or not. This is very simple about this again. So next slide, please. So sorry, back, and then Dr. Sin will help me to walk through the.
Yes, Niwat. So why I'm out of. Okay, so third activity is the fear of getting HIV in health facility or universal precaution. So the start is the same. So please access Canoe by clicking the link or by QR scan. The same start with the previous game. So please, and then we will create a code for the game. So Gigi, what is the code? So this is the code 269280. 269280. Okay, now it's this time, Koniwa, I think we don't have much time. Probably maybe one or two, maybe one person per picture, that probably might, we can save the time, I guess.
Yes, thank you. Agree. So we have like 15 peoples, 15 pictures, but I'll use only one or two pictures only. Okay, this is action, risks to exposure to HIV. You can choose your answer, risks, no risks, or not sure. Please, free answer right now. For those who cannot use the Kahoot, please type your answer in the chat box.
Okay, now we have like 13 responses.
Okay, let's start with this picture. So we have 6 said that this is risks, 5 said it's no risks, 2 said it's not sure. Can you have a picture? Come back again. Okay, can you see it clearly? Remember your answer. Can we increase the picture to large scale? So for person, there are 2 persons in the Kahoot platform said it's not sure. Can I start with this 2 persons first? Kindly explain, identify yourself, and then explain why you said that you're not sure.
Yes.
2 persons. Okay,
Thank
Umana
you,
from
Niwat.
Thailand. Yes.
I discussed with my friend. I think this picture is not sure because this is the nurse collect blood. This have blood and needle. Even the nurse use glove. Maybe have an accident. Maybe needle maybe injure the nurse. The nurse can export to HIV. This is, I think, it's not sure.
The content of this book.
Okay, thank you. You think about accident that might be happens. Okay, and what about the other persons? Yeah, another person who's also say not sure. Both are from Thailand. Okay. Why? It's the same answer.
It's the same reason.
Okay.
If have an accident, it's risk. But if not, and the nurse treat or with protocol is not risk.
Okay.
Okay, it's over.
When you mentioned about protocol, I'm not sure what that you mean, but we'll come back to this about this again later. Okay. So you said that it's risk because it's about accidents. Might happens. Okay. But for those, so there are 6 say that risks and 5 say not risks. So can I have 1 or 2 from the answer of risks group? Say that it's risks. Can you explain more why you think that this action is risks, drawing blood from the picture? 6 who say risks. Can you identify yourself and explain more? Okay, thank you. We have a picture right now. Okay, the chat box from Lao friends said that the same explanation from Thai is about accidentals, right? Okay, you're afraid of accident, so we'll get touch of the blood. Okay. So any other explanation from the risks?
This is a blood drawing procedures.
Yes.
So there is a risk of accidental pricks, even though this nurse is wearing gloves and universal precaution. Still, there is a possibility of prick injuries.
Okay.
Considering above risk, I think this is a risk.
So if I understand, you choose the answer is no risk, right, Dr. Vino?
Yes, I thought considering the possibility of the needle stick injuries, I consider it as a risk. But one thing is if they adhere the adequate precautions like universal precautions, and there is a post-exposure prophylaxis for HIV is available, in that case, we also can consider this is not having risk. But still, for the safe side, I thought it was a idea.
Okay, thank you. For 5 who says no risks, Are there any additional explanation to what Dr. Vino said? 5 of you say that no risks. Well-equipped. Onkokoy said it's well-equipped and a necessary equipment to protect from infections. Okay, that's good. So based on procedures or universal precaution, when drawing blood, you need what? Wearing gloves, it's okay, right? Wearing masks, is it under the procedures? Wearing masks. When you're drawing blood, you see that in this picture, the nurse are wearing masks. This is
wearing masks is for tuberculosis condition.
Thank you. Good answer, good response. And especially in this COVID pandemic, right? Right, yes. But when you, so wearing masks, there are the reason behind afraid of exposure to tuberculosis, okay. And the other objection, what I'm trying to intend to challenge you is drawing blood from persons in these pictures and necessarily to wearing masks. And is it under the universal precaution procedures or it's over? What about your thought? I saw Dr. Mark. You might have some good ideas. Okay, Uncle Ko said yes a bit, but from Lao said it's not over. Wow, finally I can divide you into 2 groups. Some said yes, it's over, but some said no. Dr. Mark, you have any ideas?
Oh, I think HIV. When I think in this picture, it's I'm agreed. It depends on the procedure that the healthcare workers do. If a good procedure, if the risk is very low, but if a not good procedure, of course, it's there is a risk of there is a risk because it's in the health in this procedure in this service is sometimes it's not exist, it sometimes happen when the needle like pinch into the finger of or can help professional. Yeah, it depends on the what we do.
Okay, thank you. So but the point that I would like to make clear right now, you already mentioned about universal precautions, right? So for universal precaution, what I'm understand is about you need to protect and control transmissions of the disease in your health facility, no matter what, for the whole hospitals or in the clinical room, in the inpatient room, in the outpatient rooms, or in the waiting rooms, right? So it's about protection, the spread or transmission of the diseases. So it's in the healthcare workers, the clients and their cousins who waiting or who staying in the hospital or in the clinic. So you need to protect that. So 2 colleagues from Thailand mentioned about accident. Yes, it might happen, accidents, right? So that's why you have a precaution. But in the realities, in your hospital, are there any people who lower precautions? We said that it's some Ongogo agree with me that it's quite a bit over protection because she wearing masks. But are there any lower protections, like any nurses who didn't wear a glove when they're drawing blood? Is it happen in your hospital? Or, okay, seems like no response, but or in another way is about, when you know that if suppose that I'm your patient, I'm HIV positive, you have my record, you have my patient record. When I went to the services, you know that I'm a patient, HIV patient, so you are well protected. But the others, for example, Dr. Sin went to your hospital, you don't have any record, but you know that he is a medical doctor, he looked good, healthy, you didn't wear, you said it's safe, so you didn't wear, when you draw blood, you didn't wear the glove because it's happened into his appearance and his record. You don't have his patient record, so you look in general. You didn't wear glove, so it might consider like a less protection. It's under procedures, right? Again,
Going back to me, I have a kind of, tooth plate. I need to go to the dental clinic. In your hospitals, when you saw my record, you put me in the last queue, said that this is under procedures. Some hospital have this kind of infectious control procedure, especially for people living with HIV and AIDS. You said that to save other people, you put me in the last queue. But when Dr. Sin went there, approached there, you didn't have the record, but again, look at his background. He's a medical, he's looking good, he's healthy. So you didn't put him in the last queue, you just follow on his queue. So this might happen. So this is the way that we use to address the fear of exposure or getting HIV from when you providing services or taking care of patients. You're afraid of accidentals, but again, fear is normal, right? But when you're afraid of accidental, you're trying to find something that confirm you that you're safe. So you look at the record. If you see that this guy have HIV, you feel a little bit nervous. You need to well protect, right? But if you didn't see any record, it seems like you go normally. So the way that you do actings of taking care of other people's, it's not just only private between you and your patients, but the other, your colleagues, your healthcare staff, or even though the other patient who laying down the next bed in the inpatient rooms, who see that you do special things for these patients. So this lead to discriminate, because the disclosure his HIV status without intention, you will try to protect yourself, but you didn't aware that it's disclosure his status. Or even though when you have a next turn, the next healthcare, your colleague coming, turn around with you, you warn them that that guy on bed number 6 have HIV, please kindly be careful. So you open his status, HIV status to your colleague, because you have good intention to protect him, to protect them, right? But going back to what Dr. Sino said, and the other also mentioned about we have procedures. If we do procedure, standard procedure, write the same with every person, it's well enough, to protect everyone under universal precaution. So that is fears. That is why fear drives us to stigma and discrimination. This is the activity that we're trying to lead you through. But since we don't have enough time, right? So I'm sorry that I have to finish on this, but can Gigi help me to show all the pictures to the participants under these activities? If it's possible. You see, we're trying to, yes, on this, we have 15 pictures. We're trying to let the participants, the healthcare staff in the hospital talk and share about this, whether they feel that this is risk, no risk, or not sure. So within this, you will lead them through that. Some of them are doing lower procedure under precautions. Some people doing over precaution. Some people doing special precaution, and this is not safe for the hospitals. But the way that they do over or special precaution is because they protect themselves. It's not the wrong things, but it's maybe come up with other reasons, like they are not, they feel they are not sure that
the growth that they use have high quality, have standard quality for them to protect themselves or not. So whether rather than wearing one glove, they're wearing two gloves. Yeah. When they go to bed number A, they're wearing only one glove, but when they go to bed 2, bed B, they put another glove, the second glove on the hand. So people all around notice that, and then suddenly they're curious that something happens in the hospital in the a guy's in the neck, the bed B. So he might be HIV or some things. Yeah. So it's disclosed themselves, the patient without intention. So this kind of thing is bring you to what fear drive you to doing stigma and discrimination. So can I go back to my slide, please? The slide for conclusion. Sorry, go a bit to, I think, number 30. Move forward, please. Next slide, next slide. Yeah. Or can I use my own? Sorry, sorry for coordination. It might be better, yes, with this rush. I share right now. Okay. So I will spend only like 5 or 10 minutes to conclude here. So this is the activity that I show you is one of the set of the activity that we use to playing around with actionable driver for drivers, and it's on the training, to raise awareness of the people to understand or explore more what is their opinion, why they're doing stigma and discrimination, why they're doing action, why they do overprotection themselves. So this is the activity that will lead them to that. And the activity is coming to play around with 4 key drivers: awareness, attitude, fear, and environmental policies. So the awareness is showing how the stigma and discrimination happen in health facility and what is the impact. Like you already mentioned, Dr. Mark from Timor mentioned that the impact might cause patient will not come back to the hospital again. The negative attitude, in your daily life, when you're stereotyping people, when you look down at people who use drugs as junkie, as garbages, when you look down at the sex worker like bad people, something like that, it's your attitude where it's might automatically react with the way that you treat them, and the fears that make you to use over or special UP to when you treat people that you already know that they are HIV positive. But if you don't know, you just treat them under procedure or even though lower procedure. So it's well automatically. So this is have to go back to your hospital to understand how will you solve this problem to make sure that people will go under universal precaution at the same. So this is again mentioned about we're playing around on what, why, where this driver working with you, and then how can you solve these problems. So it's start with review the form and feel the impact, find the cause, why you do that, and open mind to change. So identifying way of changing, like you said that if it's success, progress very well, people, you may not see people who use double glove in your facility again. But if someone reluctant, you have to give them more time to rethink about this, making sure that they feel secure under universal precaution. So the important things about playing around in the training, sharing, and discussion is, like I said, that open mind, safe space, not blame each others, respect to the opinions of each other. Some might say yes, some might say no, disagree, but share and find the solution together because it's in your hospital, in your clinic. So mostly the 3 principles that we use to guide, to lead us to solve the problem is right to quality health of care, So people with HIV or key population have the right to receive quality healthcare, the same standard as other people. Right to privacy, keep confidentiality, and freedom of this decision making. Mean making decision with, when you plan the treatment or prevention effort, you have to ask them what is the suit with them, what is the option for them, too. So this is the way the three principles that guide us to reduce stigma and discrimination in hospitals. The activities is coming from the Global Toolkits International and applying to Thai context. With this detail, I'll give you this slide. But the way that we organize, it's about a pack. When you need learning and challenge, you need like a pack of small number, like 30 participants in a training and fully participation. We start with 2 days, 10 activities. And when we success, with a good progress, we reduce into 5 activities from 2 days into 1 day only, because we consider the burdens of the healthcare staff and how can they participate well. So we have 2 options, 10 activity and 5 activities. This is the activity. On the green column is about the original ones and the contents. There are 10 activities that we come up, and then this is the way that we plan to organize. The first day is playing around, learning about stigma and discrimination forms, and the second day is about finding the solutions. And this is the way that I mentioned that we come up with the 5 activities, and that you mentioned when you ask the question to Niorn about implementation of 3x4, and what is the challenge? One of her response is, she said the limitation is about how to scale up with this. In 1,900 hospital in Thailand. So we have another option. It's good to doing this because it's going down into detail to hear other people sharing what their concern, what is their fear, what is their intention to change, what is the offer or suggestion for the solution. But if you don't have time, let's go back to the way to expand this is about we're talking about electronic learning about stigma and discrimination. So I will finish mine, and then going back to Kun. Sorry for the rush in the last minute, but we'll have 30 minutes. We'll invite Kun Niorn to talk about e-learning for you to have an idea, and then we'll have a question and answer. Thank you very much for your participation, active participation, and apologies again for my unsuccess for lead you through the second and the third activities. Go back to Kun Niorn, please.
Thank you, P. Niwat. Yes, and see all your, again, we will share my screen, please. Today, we talk about the S&D e-learning for health staff. To expand the S&D project in healthcare facility and networks, we organize several training sections. This reminds us of developing an easy to understand in a short time on the e-learning platform. We adapt this book to e-learning platform. For timeline, we start by S&D expert team meeting, creating, developing, and pilot, and then launch in the Zero Discrimination Day and Bangkok Metropolitans, and publicize and just promote to site level in this year. The content consists of 4 modules as follows. Module 1 covers the S&D situation related to HIV/AIDS and key population, and 2, meaning, causes, and effects of S&D, and 3, understanding of HIV transmission, universal precaution to reduce fear and S&D, and 4, environmental management and correct practice to reduce S&D. The objectives are to encourage for health staff, and expanding the coverage of self-learning activity for understanding of reducing S&D for HIV for the benefit. Healthcare worker understanding and provide the quality service, and also the healthcare setting provide quality service like a friendly and standardized service for free from S&D related HIV. And then we will start for the process. One, log in by the mobile phone number and start from the module 1, not to skip lesson. And then for healthcare worker, take about for 1 hour, and other staff only 40 minutes. In each module, if you don't pass, you need to go back and do the test again until you pass. You can come back to the next lesson if you suddenly stop studying. Finally, you will receive a certificate from the Department of Disease Control if you have complete 4 modules and pass the post test. We will start for the module 1 for the introduction. You will start for the watch a video. The video will say about what S&D e-learning, situation in healthcare facility, understanding the origin of bias and bias S&D related HIV/AIDS that makes people afraid for HIV testing, and people live with HIV may not attend or retain continuous in the treatment system. And if you then you do the post test and conclusion. If you pass the test, you can go to the module 2. This next. For the module 2, about the meaning, causes, and effect of S&D, you will do about the attitude assessment, and then conclusion and watch a video. The video will say about what is S&D, and for actionable driver about the lack of awareness, fear of HIV infection, social stigma, and environment in health facility. That you remember, this is in the T/4 concept that Niwat said, and also show about the example of S&D seen in healthcare setting and the impact on clients and the health service system. And then module 3 talk about the understanding HIV transmission to reduce fear about the universal precaution. Also, you will need for the knowledge assessment and watch video. The video say about understanding the risk factors for HIV transmission to reduce the fear and discrimination. Review and provide followed by universal precaution to reduce unnecessary protection and ensure safety services for both providers and clients, according to the Niwat say later. And then you will need for the post-knowledge assessment and conclusion. If you pass, you can go the next. For the module 4, about the environmental management and correct practice to reduce S&D. This module, you will watch a video first. A video will say about describe the correct practice, environmental management in the organization to reduce S&D, understanding and awareness to catch up with bias ideas and don't do any discrimination. And then you do self-assessment and conclusion and next. If you pass if you pass the post test, you will receive the certificate from this program by yourself. You can print by yourself. This program can know about the cumulative number of users that registered during 3 years ago. The cumulative number of personnel attending S&D learning about nearly 20,000 persons in nearly 600 settings. 67% for healthcare workers in 77% in healthcare setting. For other settings, including prison, HIV positive leaders, civil society, Ministry of Social Development and Human Security, Ministry of Labor, and others. This slide shows the Bangkok Metropolitan Administrator had the highest number of users because it was the first area in operation. This is Department of Disease Control in regional. We have the 12 regional for DDC. And this year we promote and expand STI learning for regional and provincial. This slide shows the categorized hospital and health center in Bangkok. Most of them are higher from hospital. About this is the health center. Bangkok has around 66 health center. For promoting STI learning, we have 3 circles for the policy promotion and follow-up summary and result. For the explain collaboration in the DAY3 project, self stigma project, and crisis response project. For the next step, we're planning for give credit we call for Thailand or continuing nursing education unit or CNEU for nursing. But I'm not sure because we don't do about the request for this credit from e-learning, but we will try with the nursing council. And then I talk about the pushing for the e-learning collaboration for the T project. That you remember? Do you remember the S&D learning is in the individual measure in the DAY3 project, and then we plan to evaluate the e-learning program. Okay, thank you. This is too short because e-learning is for the easy to understand and easy to do it. Thank you.
Okay, that is briefly about e-learnings in our country. You maybe already see that e-learning is easily accessed by the healthcare staff because they can do by their own self. But e-learning have different characteristics with the in-person training, because in-person training are involving of 30 persons from different clinic, different division in the one hospitals. But for e-learning, you can do it by your own, but it accesses a lot of numbers. So, but mostly these two activities are approaching at the individual levels, even though the training, in-person training also, because it approaches the learning at the individual levels, but come up with the conclusion that each individual will come up with their suggestion of to write down the code of practice to reduce stigma and discrimination. And with this step, this suggestion from the training will shoot back to the system levels, to the executive level in the hospital to consider. Each of the head of the division will consider whether, when their staff suggest to, if it's possible to reduce stigma and discrimination. This is under the 3x4 program. So we start with the surveys, and then going deep down into detail from individual levels, try to change from the individual levels, and listening to what kind of suggestion and advice from the individual level to better improve their qualities in their department or clinic, and then send it back to the system. The system level will consider whether if it's possible to do or not. This is the whole process. So we have 10 minutes right here left for today for question or comments. Are there any question or comments?
Yes. Pierre mentioned that this is the actual announcement for all the participants. So we have a guide to the participant training activity that the Niwat demonstrated, and we will send to the participant with the document on the 3x4 package through email later.
Thank you.
So any question from the participant, please?
Yes. I'm sorry that we rushed in time. This is my first time on doing the training online, so I learned a lot on that. So can you repeat? Sorry, I didn't see. Okay. It seems like there's a question from its divisions, said that she would like to hear. Oh, Anissa said that, okay, go back to, can you repeat announcement again, Dr. Sin?
Niwat.
There might be someone who didn't hear clearly about the announcement. Can you repeat?
Okay, so I will repeat. So we have a guide to the participatory training activity, which was demonstrated by the Niwat today. We will send to the all participants with a document on the 3x4 package through email later. So you will receive the email from our colleague, our team about the training activity and also the 3x4 package activity guidebook by email. So if anyone who is not clear.
Yeah. So we'll send all support document to you that you can learn from that, from email. Or even though, you know, the other way around, if you're interested in, you can use Google, searching for, you know, stigma and discrimination related to HIV, reduction in health facilities, something like that. So come up with lots of training guides for different groups also. But in Thailand, I think the S division will send you all document in English, so you can learn from that and apply into your context. And the demonstration in the previous session might help you a bit about the idea to imagine what will happen in the training sessions. So, and then you can try, or applying for the next training when the COVID situation is far more better than this, and then you can come up in learning in person with us again. So this is, I think the what is the announcement for. Yeah. So I didn't catch up with the chat box right now, but it seems like there's some question chat in the chat box going to you, right? About, I think, where is it? What is the benefit for e-learning to all participants?
To me?
Before we finish the training today, what do you think is the benefit of e-learning from your point of view?
Okay.
Huh? Any participant would like to respond to this?
Please check the chat box. I made a question in the chat box, please.
Okay. Can anyone who see the chat box please kindly find on Google questions?
To Mr. Uncle, your question to who? Because we can't see in the checkbox.
Okay, I saw it. If
you saw it,
could
okay.
not do well in the self-assessment, can we do it more times?
Oh.
Okay.
He's
So
asking the question about stigma of association. What is it?
Yep. There also a question from Tanzania about stigma of association, right? So it's mean sorry, I'm too rush for that, but stigma of association, it mean sometimes it might happen. It might the stigma might happen within your family members when other people know that you are HIV positive, and your family member might be stigmatized or discriminated because of your HIV status. For example, in Thailand, in the past or until right now, children who were born from HIV families, might be, afraid of the entering the school, So in some school, they reject to receive HIV children, not HIV children from HIV families. Some school are also, go deeper into asking to do blood check for the children that they are not HIV positive before allowing them into the school, something like that. So this is a kind of stigma of associations.
Thank you very much. I understand now.
Thank you, Dr. Albert, for the question too. So any other question? But I'm not sure. Uncle said, okay, there's someone explained to you already. Okay. Sorry, my eyes is poor. Sometimes I cannot see. You smile with me again, Anissa.
Because I experience these things a lot.
Yes.
For instance, I was in charge of the COVID isolation in my hospital these days. So there was a lot of stigma of association, not related to HIV, but otherwise also. Yeah. And people used to avoid me in the beginning because she comes home after treating patients of COVID. So my relatives, neighbors, they stopped seeing us. They stopped calling us. So this is stigma of association.
Yeah. Yes. Okay. Some might happen within the community, in the hospital too, because in Thailand, many antiretroviral clinic managers, or she is a person, or they are a person who in charge with HIV. They said that no one would, sometime, some of their colleagues are afraid of talking with them because they're dealing with HIV patients. So they're afraid of, she might, or they might get infected and then might pass or transmit the virus to them. So this is also happened too. Okay. So last minute.
Let's say one question actually not answer, I guess. How to e-learning apply with 3x4 package from our Thai colleague?
How the e-learning apply to the 3x4 packages?
Yes, I think that is the question that, you have not responded yet, I think.
Okay. Niorn or me?
Yes. We apply for the e-learning instead of the meeting together because it's suitable for these situations, for COVID situation. And if you remember, the e-learning is the one of the measure of individual measure in the 3x4 already. And now this year we will promote for this is for the UN indicator, also for the expand S&D e-learning. This is for benefit for the healthcare understand and provide quality service with the for free stigma and discrimination. And you can do e-learning more time if you finish and receive the certificate already, and you would like to review the content or the knowledge, you can come again, but use the new number or the phone number. Thank you.
Okay, so we approaching the last minute pass already. So today we use
3 hours. It seems like not enough time, but apologies again for some session, some period that is very rushed for you. But I hope that we'll come back tomorrow freshly. For those who did not finish the pre-test yet, please kindly go back and do the pre-test by tomorrow. And then, okay, so if there are nothings, I'll say thank you to you and go back to the Bangkok studio for last minute announcement if you have, please.
Thank you, Khun Niwat and Khun Niorn for the today presentation. We don't have a special announcement for tomorrow and the day after tomorrow, but the same time the training will start 10 a.m. Bangkok time. And also, please, we would like to encourage to open the camera as much as possible if you are convenient. Also, the announcement that I made is we will send the training material to your email. Please read it and also can share to your colleague. So today, also apology that we try to manage to put it in time, but because of the inexperience in the online training, so some are beyond the time limit, and also we could not finish all the card and all the responses. So apology on behalf of our organizing team. So I think now is over 3 hours already. So thank you very much. So we will meet again. So in Thai, what we call ขอบคุณมากครับ
ขอบคุณครับ